Welcome everybody. I'm Rachel Stancliffe, the Director of the Centre for Sustainable Healthcare. So welcome to the NHS Forest annual conference, a chance to learn in more depth about what a few of the sites have been doing and to celebrate all of the hard work that you've all been doing on the ground. Can't be together in person, but we're looking forward to sharing lots of different spaces with you. As many of you know, the NHS Forest is a programme of the Centre for Sustainable Healthcare, which is a charity supporting health systems to become more sustainable. We work with groups of healthcare professionals on education, policy change and practice, and we've always tried to combine that with physical change to the healthcare estate. The NHS Forest started as a project to plant 1 tree per NHS employee as a way of engaging staff with the importance of the environment and its links with health. 12 years on, much has changed, and despite the worsening of the climate crisis during this time, many more people are engaged with the real benefits of green space for health, thanks to the efforts of so many people in different parts of society. You'll hear from some of those people today. Our shared goal remains to engage, collaborate, and act to improve the health of people and our environment. We're using a platform called Hop In Today. Please use the stage chat to the right of the screen for any questions. We'll be putting a selection of questions to speakers during Q&A sessions. You can also choose the People tab to see a list of other participants and to message them. So we're delighted to have excellent speakers today, starting with Judy Ling Wong, Honorary President of the Black Environment Network. Judy is a painter, poet and environmentalist. For 27 years, she was the UK Director of the Black Environment Network, with an international reputation as the pioneer and creator of the field of multicultural participation in the built and natural environment. Judy is a major voice on social inclusion and a visionary advocate for diversity and equality. She's been awarded with many accolades as recognition of her work, including an OBE. So I'd like to invite the audience to ask questions in the chat for the 5 minutes Q&A after Judy's presentation. Judy, over to you.
It's a pleasure to be with you all. Let me say that on some slides you'll find a lot of text, but you can have the PowerPoint. There are notes for you which I'll not read out, so listen and enjoy the images. I would like to begin by congratulating NHS Forest for your ambitious scope of intervention. Decades of working with multicultural communities has given me a very particular overview of relationship to nature. Black Environment Network asserts that there is no such thing as a purely environmental project. A so-called purely environmental project is one that has rejected its social, cultural, and economic dimensions. The death of George Floyd has sent a wave of emotion across the world. Black Lives Matter has created a worldwide impetus to action for diversity, equality, and inclusion. It is a good time to work for inclusive access to green space to enhance health and well-being. What I touch on is applicable to all disadvantaged groups as we have so much in common. To address green space and equity, it is desirable to move on two fronts, drawing from the inspiration of diverse cultures and taking structural organizational action. Let's start with inspiration. Early on in the history of Black Environment Network, we worked with a group of Bangladeshi women that wished to find somewhere to grow vegetables. The final evaluation question was, what was the best thing about this project? The typical answers would have been good fresh food, better health, meeting new people, or simply the pleasure of being outdoors. However, the answer of this group blew us away. They said, the best thing about this project is that our bare feet are once more upon the soil, our mother. It demonstrated a visceral connection, emotional, physical, and spiritual, all at the same time. A connection that is about a deep human need, a cultural vision of what it means to be alive on our planet. This is our urbanizing world, with deprived populations living and working in places without a single shred of green. Access to nature must rise up the agenda. There's a bleakness in our science-dominated world that calls for a new balance. The NHS Forest is poised to make a significant difference to many people's lives. I propose that we can be stimulated and supported in our search for a 21st century context for well-being through looking at different cultural visions of nature and be inspired to creatively retrieve what is missing in our lives in the green spaces that the NHS Forest provides to staff and to the public. When I was a young person wandering around in South India, early in the morning, I saw village women come out of their houses and draw a rhythmic pattern with rice powder on the ground in front of their homes. To my astonishment, when they finished, they just took a broom and swept the beautiful creation away. I mean, they didn't take a photograph, stand admiring it, or think about the work they had put into it. I was told it is an act of devotion for invoking the blessing of their homes. This demonstrates a completely unmaterialistic way of being, linked to values of beauty and spirituality. Tomorrow and every day, they will do something equally beautiful but different. In Mexico City by the cathedral, I saw traditional dancers. I asked them, why were they dancing there? And they said, well, the cathedrals were built on top of our sacred places. So when we dance here, we're dancing on our sacred land. Once at the end of a conference in England, a Morris dancer came up to me and said, yes, the same thing happened here and all across Europe. Churches were built on sacred pagan sites. Perhaps we too should be dancing next to our churches. And a Huichol tribal member said to me, the West has taken the words Mother Earth, but for us, there's also Father Sky, Grandmother Moon, Brother Deer. When we take care of the environment, we're only taking care of our family. If you visit this wood, you will see nothing but trees. I'm missing a slide. I'm sorry about that. And you would see a woodland with Sikh community in their wonderful costumes, actually. The memory of color and ceremony are a thing of the past, but the Sikh community has marked this place with memory, a significant cultural association. It's in reverse. Now you see it. Okay, so you have seen that. So I go back to the other slide, which is about the use of natural materials. So you will see here the natural materials in which you can see wonderful building that has no windows because they don't need them. And they have marked this place in a way that it's really design-wise absolutely imaginative. And when you walk in this building, the whole building actually shifts and moves. Now, in China, look at those tiny plants clinging to the cliff, growing out of crevices in wild weather. Stunted but perfect. They are the original inspiration for bonsai plants, your own little bit of wildness, symbolizing the heroic character of human nature adapted to the conditions of wildness. And indoor plants, if you research where they have come from, you'll find that they connect us to the great forests of the world because they are from the forest floor where there's very little light, enabling them to survive indoors here in the UK. We can connect to different cultures through the arts, for example, with poems. They encourage us not to think about, but to absorb cultural meaning. Here is my very Zen poem. Today I went swallowing skies to feed my being. The seagull cried wild against the sliding of the tide. Why, of all nature, do you choose to swallow emptiness? Nature is unnecessarily beautiful. We are born out of nature and we are of that ilk. We want more, much more than beyond mere survival. Encounter with cultural visions can give us a glimpse of the possible journey of the retrieval of richness to create a 21st century portfolio of actions for well-being. Now, let us look towards structural actions for diversity, equality, and inclusion. Policies for people. The best way to shape inclusive policy and actions is co-creation. We can understand the concept of policy making at different levels, organizational, or simply as how we as individuals want to go about what we do. What follows are lists of actions to build diversity, equality, and inclusion. I will only pick out certain points and give examples. This is because a lot of the points are very obvious, but they still need to be listed. You're welcome to these slides afterwards. So notes for you to look at later. I'm going to highlight number 4, support representative instruments as exemplified by Climate Reframe. Do Google Climate Reframe. About a year ago, the Dog Society challenged the media as to why multicultural voices were not appropriately visible. Their answer was, where do you find them? Dog Society responded with researching 100 established multicultural environmental experts and activists and put them into an open database. So now they have no excuse. This database is moving the goalposts as it's being used by media, conference and event organizers, plus organizations to identify possible candidates for committees and advisory groups. A second stage development aspires to include emerging voices to take it to 1,000. You might help to nominate them. This is a model for elevating the voices of all disadvantaged groups. Do contact me if you wish to engage with this. And it has some of the rising generation of multicultural environmental activists. Strengthening the policy position. This is about power to your elbow. All of us, organizations or individuals, can use wider policy instruments, reports, and overarching concepts to push the actions that we want. Here are some significant examples. You may wish to refer to the declaration of this forum that gives stakeholders more prominence, or refer to the new urban agenda with the forceful assertion that no one should be left behind. Here is a powerful quote. The UN Habitat's Deputy General asserts that the battle for sustainability will be fought, won or lost in our cities, linking environmental quality, including access to nature, with human settlements. Wales leads the way with integrated thinking. Here are those 4 keywords that Ben used in 1987 for a cohesive approach to environmental participation. Representation. The presence of representation of affected communities within decision-making structures is where we need to get to. Engagement delivers representation and relevance of actions. Number 3, power sharing is probably the most challenging. To be able to hand over or give up power is the ultimate test of equal partnership. Number 9, providing a welcome is a great point. It is a two-way street exercise. You can provide enjoyment, but you can have fun doing it too. Here is a red inviting people to help knit this tale and at the same time give out all kinds of useful information. Here I would like to highlight number 11, establish a positive organizational image of genuine commitment, a real challenge to do that. And moving on to provision. Provision related to policy are concrete actions that result in a better quality of life. You do not have to do any of this all by yourself. All over the countries are organizations close to their communities that can help you to work, communicate, and provide for target groups. London National Park City is a wonderful example of a powerful grassroots organization that you can link into, and they demonstrate superb use of websites. This is another one of their panels on their websites. Now, reimagine places in partnership with others, way beyond NHS Forest grounds, so the environment really changes cohesively for everyone. Look at Liverpool with wildflower meadows on the grand scale, or Kilburn Underground. 1,000 people go through the station every day. If we really look and reimagine, there are opportunities everywhere in the built and natural environment. Bleak spaces are opportunities, even when they are grey. We should begin to think of every grey space as having the potential of being part of a forest floor. Infusing our practical and structural actions for equity with beauty and meaning goes a long way to make health and well-being a reality. Indeed, if not now, then when? To end this talk, let's take something from the ageless wisdom cosmology. In the West, love is highly romanticized. Within the ageless wisdom, there's a term called love wisdom that sees love as something leading to sharp strategic actions motivated by love for people. Within that way of seeing, policy is the expression of love wisdom, and its practical outcome is beauty. The beauty of people and nature thriving together. In other words, physical and mental health that makes up a sumptuous form of well-being. Thank you for listening.
Thank you so much, Judy. Wow. Policy as an expression of love wisdom. That's amazing. Now, have we got some questions for Judy? Let me just have a look in the chat. Does anybody want to put a question for Judy in the chat? Otherwise, maybe I should ask you about how you're going to relate some of that to what's happening at COP, Judy.
Well, there's so many issues at COP. I'm a people person, so I accentuate the people dimension. I've been asked by BASE to join a panel on gender and also represent gender and race at COP26. So I'm really looking forward to it. As you know, women make up 50% of the planet. And we're not providing for especially girls and women in developing countries, because we all know that when you provide for women, the magical thing happens is that population falls. No one wants to be burdened with lots of children and unable to feed them. And we need to upskill women to take up all the green jobs as well. In this country, there's about to be a wave of green jobs as part of the government's strategy for net zero. And we want lots of those jobs for women.
Absolutely, totally agree. Well, we're doing our best at CSH. We have an embarrassingly high number of women on our team, which I'm very
It's funny, in certain professions, like caring professions, of course, women outnumber men, and we need a balance where we have more caring men coming into the profession.
Of course. Now, I've got a question here from Bill McAllister Lovat, and he says, how do you relate sense of place to love?
Well, we don't think about it. I mentioned it a little in my talk, but throughout our lives, wherever we live, if it is a beautiful or pleasant space, we have marked that place with memory. That's what produces a sense of belonging. And if that place is beautiful and you have lots of layers and layers of memory of that place, you will begin to love that place. It's a natural human process. That's why it's so awful in deprived areas. People cannot love their surroundings. If you cannot love their surroundings, you don't have an impulse to care and protect those places. So it is a great thing what NHS Forest is doing to increase those number of places that we can love and are motivated to care for.
Absolutely. Thank you very much. So another question here, what structural actions can be taken to enable more deprived communities to be able to take up those green jobs you mentioned?
Yes, deprived communities have a great need for access to nature and green spaces. And sometimes we think of green spaces only as formalized boundaries of parks and gardens and so on. And in many urban areas, you just don't have the space to have new, substantial parks and gardens. So we need to begin to think of other areas that can be turned green. I mean, I didn't show a slide, maybe I should have, but a local area where I live around Vauxhall, quite a deprived area with old houses along the streets and so on. Over for about 30 years. Now, Lambeth is a really special kettle of fish as a local authority. They really give people a lot of freedom. So they don't mind if you do things like let front garden plants spill onto the pavement. Put big pots, including large, cheap rubbish bins, onto the front of the houses and plant trees and large bushes. Take up paving stones and plant plants and flowers. They allow all of that. They just say, well, as long as you leave enough space on the pavement for a buggy and a wheelchair to get through, what exactly is the problem? So you actually see certain neighborhoods so green that they're like a jungle. So these sort of good practice examples where you can see people like yourselves, ordinary citizens, doing things and transforming whole neighborhoods into natural gardens and oases with birdsong everywhere, then you're encouraged not only to want for government to do things and help you to do these things, but also to do it yourself. Because, many things like plants and so on, if you learn to take cuttings, people with gardens can share the most wonderful plants and you can have them for nothing.
Yeah,
we need to think of that in that way. Not always funding, we can do things for each other.
Thank you so much. That's so important. So Camilla Jagor here asks a question: I would like to introduce such policies to the charity I work for. Where do I start?
For a start, if they're recording this presentation, show them. I mean, there's lots of examples here. I have more examples that really my presentation was already bursting with slides, but I could have shown you much more about what people can do. You need to inspire people. They need to see these things. That's why slides are so important in presentations. Talking about places is one thing, seeing them is another thing. And as you have seen in this presentation, by seeing them, not only can you replicate certain things, it sparks your imagination. You'll come up with your own ideas.
Yeah. Oh, that's brilliant. Lovely. And a good place to stop, I think. So thank you so much. That was really, really beautiful. So nature as visceral, physical, nature as values and family, and nature as art, and that idea of absorbing nature and swallowing it rather than just thinking about it. Thank you so much, Judy.
Thank you, everyone.
It was wonderful. And I'd like to introduce now Dr. Becca Lovell. So Becca is an expert in nature and health based at the European Centre for Environment and Human Health at the University of Exeter Medical School. Becca's interested in the multiple roles of the natural environment in determining equitable population health and focuses on evaluating, synthesizing and translating evidence of the links between nature and health for policy and practice. Over to you, Becca.
Thank you very much. I'll just share my screen. Can you just let me know if that's the right screen?
That's showing perfectly.
Brilliant. After a year and a half, it's still stressful. Thank you hugely for giving me the honour to come and speak to you all today. And I'm afraid I'm going to follow Judy's wonderful, beautiful talk with some dry science. But it's really lovely for us to come talk to you, because what I'll talk about is the culmination of quite a bit of work that we've been doing in the centre over the years. And I was asked to come and talk about what we know about, the evidence that tells us about what works in using nature as a tool in equitable recovery post-COVID, how we can think about nature as a tool in contributing to promotion of health and prevention of poor health. So I'll run quickly through that, and I'll use a tool that we use in public health to give some structure to that, and I'll talk about that in a moment. But I'm going to finish up by talking a bit about the importance of how we work. So echoing some of the points which Judy has already beautifully introduced to us, and who we work with, and particularly whose voices are heard. And I'm going to take this from a context of sort of authoritative voices rather than inclusivity perspective. But my slides are going to be available if anybody is interested in anything I talk about. So I just want to very quickly say, and actually echoes a point that Judy made, I come from an academic perspective, and we have for many years been trying to produce evidence on how nature relates to health. And some of that's, its intangible benefits, which is very difficult to document. But actually, we're getting to the stage now where we have a substantial body of evidence which does describe the many different ways that nature relates to health. However, having said that, we still only have a very partial picture. We have some of the pieces of the jigsaw. We can't see it all as of yet. And I think this is because it is a hugely complex question, how the very many different types of environments and the very many different ways in which we're exposed to those environments or experience those environments or relate to those environments relate to the many different sort of health outcomes that we know nature probably relates to. And the interactions between those, you think about your everyday life, you have nature in your garden, you'll see it when you commute to work, when you commuted to work, it's in your workplace, it's in your leisure places, and there are lots of different pathways. So I do just want to say that our understanding is still partial. We're getting a good sense of some of the the broad pathways. But when we're asked the so what questions about what do we do about it, what do we plant where, and what kind of parks do we place in different bits of the urban environment, we're still putting those pieces together, and I'll sort of emphasize that as we're going through. Just on the screen there are a number of different images of some of the reports that we've produced for a number of different government bodies, really, which summarise this evidence. So I'm not going to talk too much about specific pieces of evidence, but I'll talk about the sort of summary, that the accumulation of evidence that we have. So I thought to bring some structure to this, as I was saying, this is a massive topic. I'd use something called the prevention pyramid, and this is a tool that we use in public health. It came from the World Health Organization as a tool that we can use to organize and think about and understand all the different ways in which we can promote health. And it tries to bridge the population health stuff that we do through to the very specific therapeutic, individual targeted stuff. And the point I want to make is that nature and the environment is fundamental to all levels of the prevention pyramid. So all the ways in which we think about how to improve health. And it's fundamental to both promoting health and sustaining health through to those very targeted therapeutic ways in which we might want to prevent poor health. So we think about primordial, and this is protecting the basic stuff of life, the stuff that keeps us alive and gives us a basic sense of well-being. And actions here are the things which Judy's already talked about. So protecting our environment, thinking about environmental protections, reducing climate change and so on. And then we can move up to primary, and this is actions that we take at a population level. So this would be something like public health and population health. And this is where these are blanket actions where small changes can have big impacts because it touches on a lot of people's lives. And the kind of environmental impact action we could take there are things like the provision of green infrastructure. And then we get to the secondary and tertiary, and these are where they're very specific targeted actions which are used to either reduce risk factors for people who are exposed to environmental harms or social harms, or who have specific risk factors associated with their genetics, for instance, through to tertiary, which is where people have developed a poor health, or a health condition. And this is where we use very targeted specific actions, and that can be about the resource. So again, thinking about putting something like a green gym in a local park in a population in need, through to very specific nature-based therapeutic programs. So we might use talking therapies, for instance, for people with poor mental health. So I just want to emphasize that nature, as far as we're understanding with the evidence at the moment, is fundamental across all levels of how we try and address health. So I'm going to just work through these very quickly. And so starting at primordial, this is about protecting the basic facets of health. My colleagues and I earlier in the summer produced a report for the World Health Organization as part of Biodiversity Day. And this report was written in quite simple language, and it's targeted at policymakers and decision makers and people who don't necessarily think about the role of the environment to what they're doing. So it's trying to bridge that gap between the people who know about this and have those tools about understanding ecosystem services and so on, but also the things that they're doing impact on the environment or are relevant to the environment. And what we try and make, the points that we try and make in this report are that nature is absolutely fundamental to our very survival. And it's interconnected. We can't focus on these things independently. Take freshwater systems, for instance. It's absolutely fundamental to biodiversity, and biodiversity is fundamental to the production of freshwater through ecosystems and so on. And if we start to lose these resources, we lose all sorts. We lose the basic stuff of life, but we also lose huge amounts of potential. For instance, infectious disease control through to new medicines and healthcare. Quite a substantial amount of our medicines come from natural compounds or inspired by natural compounds. And it's that codependency that's really important, and it's a point I'm going to pick up again in a moment. Just quickly moving on to primary. Sorry, I'm going to whiz through all sorts of bits of evidence here, not give it enough time. But moving on to primary, and this is around these population level actions that we can take. And here we have quite a lot of evidence, actually. A year ago, actually, we wrote a report for Natural England's new green infrastructure standards. So trying to work out what is good green infrastructure standards. Well, it's good green infrastructure to inform these standards for planning and so on. And we were asked to summarise the evidence relating to health and to answer a number of questions which were posed to us about what is good green infrastructure, where it should be, what it looks like, and so on. And we wrote a rather mealy-mouthed report saying at the moment the evidence isn't quite there to answer some of these questions, but that there are a number of principles that we can follow about how we green our living environments. And what we suggested was that the weight of evidence does suggest that greener living environments are healthier environments. So we have a huge body of epidemiological evidence now which suggests that people who live in greener environments, after you control for other factors which relate to health, so socioeconomic status, access to healthcare, education, and so on, tend to be healthier. And there are a number of direct and indirect pathways that we think that relates to. So yeah, the direct pathways are provision of activity, social spaces, and so on. And the indirect ones are about amelioration of poor air quality and reduction of other environmental risks. And we suggested that while we can't yet say you need a certain type of green infrastructure for a certain community for certain health outcomes, what we do know is that mixes of green infrastructure are really important. So, green walkways, public parks, a mix of public and private is also really important because they play different roles. So private spaces have very different ways in which they might benefit your health to a public park, for instance. And we also said that accessibility is key, but very difficult. Accessibility can relate to both the psychological understanding of a space being for you and being safe and attractive, through to very basic accessibility in terms of physical, availability in terms of whether it's there, but also whether you can get into the space and use the space. So in a way, we sort of failed in our mission, but actually, I think this very inherent complexity of the links between environments and health is sort of borne out with the conclusions that we put in that report. But we did manage to produce some fairly robust statements around the importance of the space itself. So what it actually looks like isn't so much as important as what the state of it is like. So that can be about the ecological state. So we know that people appreciate biodiversity when they think it's there. They don't necessarily understand it particularly well. When we ask people to estimate the number of species in the environment, it's usually a bit haphazard as to the response we get. But when people perceive it to be biodiverse and ecologically good quality, they feel happier, they want to spend time in those spaces. The social state is also really important. So whether people feel that it's cared for, whether there's certain types of environmental incivilities which are read by people in such a way as that it may well not be a welcoming or safe space to be. And this ecological and social state interact. So when we ask people about how they feel about increasing the biodiversity of their living environments, universally very popular idea. But then when the reality comes by, people are upset by the lack of mowing, the perception of messiness. So when we're trying to use some of these tools to improve the quality of spaces, we need to think about that interaction between the ecological as well as the social. And it comes through to this idea of quality and qualities as well as characteristics of spaces being fundamental to whether or not they will be health conferring. And the idea of certain spaces being beneficial to certain communities at certain times. And I think, when you think about how you've used green spaces or natural environments throughout your life, or even through the week or through the year, it varies hugely depending on the context and who you're with and your needs and desires. And when you're thinking about that in terms of a planning situation, that makes it really complex. It makes it very difficult to make a decision about what to do. And I think this is where Judy's points about talking to communities, working with communities of all different colours and stripes and so on, about what it is that they need and they want, and finding compromise is really fundamental. One of the most interesting and tantalising things that we've found in the literature over the last few years is that greener living environments and certain environmental features, so here I'm thinking about things like coasts and so on, may be equigenic. So this is where we think that green spaces may contribute to reducing the impact of health inequalities, socioeconomic related health inequalities. And now moving on to tertiary and secondary pathways. And this is where we use nature either as a setting or a tool to address specific health outcomes. And there is a small but growing body of evidence that nature-based activities, whether that's the provision of a space in itself or the kind of activities that we run in those spaces, are effective in their many, many aims. And this is where my point before about the complexity of this field gets quite pertinent. When we think about the kind of activities which people are delivering for green social prescribing, for instance, they are very plural. People are using it to build resilience, to help people maintain their mental health, to improve their mental health. there's physical activity programs, there's programs to deal with musculoskeletal outcomes, and all these are very specific actions with very specific pathways to benefit. So we do have some sense that they are likely to be effective. They are often very well received, and so far we think they're cost effective, but that evidence is still building. But going back to my point about how these programs work, so we're not only interested in just whether a green social prescribed activity is effective, we're also very interested in understanding how it's effective. So what are the sort of active components of those programs? And some work that we've been doing down in the centre, a suite of projects actually, has been trying to unpick these programs and think, well, what is it about using the natural environment or using the natural environment as a setting that could be effective? What are those sort of pathways and things that are happening that confer benefit? And we've produced a bit of a handbook to help people who are delivering these programs think about these active components. And we did another evidence synthesis to try and pick out from the literature what we already know about this. And what we found was that nature programs or nature-based activities to promote health, and particularly mental health is what we're all focused on with this, are really complex, but actually really interesting. There's a whole range of different things going on. So often you're caring for an environment. Often there's an element of creativity. There's a big element relating to being outside, being away from institutions, for instance, and developing a relationship with nature, so a relationship with the other. Many of them involve physical activity, which, as we all know, is something we all need to do more of. There's often an element of personal growth, so progression, learning new skills and so on. Having fun. Many of these programs just aim to give people an enjoyable experience out of, often quite pressured, difficult lives. The group element is also really important, but I think one of the things that really struck me, and actually when we're thinking about social prescribing and the sort of suite of different programs that you can be offered, that makes nature on prescription and these nature-based activities stand out, and it picks up again on my point about these co-benefits and complexity of what we're doing, is this idea of making a difference. Often the activities that we are offered through nature-based social prescribing, for instance, benefit the individual. You benefit from being part of the group and being active, all those pathways there. But actually what you're doing, if you're thinking about some of the conservation activities that Wildlife Trust and others run, you're actually improving the environment, you're looking after the environment, and that can benefit both the community but also the ecosystem more generally. And there's not many of these kind of programs which have those nests of benefits, which I'm going to talk about in a moment. But we do need to ask ourselves difficult questions about how we use and promote spaces, and this matters for the outcomes in equity. We need to think about equality. We need to think about whether these are the best programs to use in resource-constrained environments, and this is going to become a really big question post-COVID. We need to think very difficult questions about avoiding harm. And just as a quick example here, these programs are often thought of as quite neutral and quite unlikely to cause harm. And I think in general that's true, but there is potential to cause harm. Some colleagues down in the centre produced some work, and it is cross-sectional, it needs exploring more, looking at the role of nature for people with anxiety disorders. And they found that perceived social pressure, so people who felt that yes, they had been pressured to go out in nature, so maybe their family was saying go outdoors, it's good for you, was associated with a higher visit likelihood. So they did go out more often, but it was associated with a lower intrinsic motivation. They didn't feel that they wanted to, it wasn't themselves that was driving that. But importantly, it was also associated with lower visit happiness and higher visit anxiety. So people were maybe performing something that they felt that they needed to do, it wasn't coming from them. And this is a well-established psychological sort of dimension that we know about, but it is important when we're thinking about how to message and promote nature and the use of natural environments for health. What I'm going to finish up with today is just talking about the co-benefits and interdependencies. The things that we do don't happen in isolation. I think Judy was making these points that we're all connected. The things that we do as individuals or institutions have impacts and consequences elsewhere. As a very, very quick anecdote, I wrote a chapter for the Chief Medical Officer's annual report this year. And there were questions that were asked about whether the report should include a chapter on natural environments. Is this really of any relevance to the health sector? And we said, yes, of course it is. You just have to look at the number of people here today, the number of primary care trusts of sustainability champions, the work of the Centre for Sustainable Healthcare and others, people do care, and authoritative voices coming from the medical world are incredibly important. And taking out that point about individual actions having global consequences, if you take the example of a hospital greening its environment, we know that at the direct level, we know that the use and the creation of that space has individual, community and therapeutic benefits. That's nested within the neighbourhood benefits. So greener environments we know relate to better health and well-being, and people's living environment is very strongly related to quality of life. And then that's all nested within those ecosystem services at the local and global scale. So that action to preserve or create a green space around a clinical environment has these multiple levels of benefit, which I think as researchers we're not very good at articulating, quite often trying to unpick these things to understand what's going on. But I think it's incredibly important to think about how we all contribute and work towards these big aims. And then finally, I'm just going to...
Sorry, you're just up to time, so...
Thank you, Rachel. I'm just done. I just very, very quickly want to finish by saying that the health potential spaces and practices are dependent on these wider systems. Nothing that we do happens in isolation. And thinking with social prescribing, it's absolutely fundamentally dependent on the wider social system, the infrastructure that we have around us. Everything from the availability of buses to the availability of green spaces to use for social prescribing. But very finally, I just want to conclude that emphasize this point that nature is absolutely fundamental to everything that we do in health sciences and the ways in which we promote health and try and prevent poor health. Thank you very much for listening. I'm sorry for whizzing through and going over time.
No, absolutely. You're just up to time. That's fantastic. Thank you very much, Becca. Good. So I have a couple of questions for you. So what are the group aspects of caring for an outdoor environment?
What are the group in terms of benefits?
Yeah.
I think, like I was trying to say right at the end, I think the group elements are really important. There are the sort of direct things about working as a group and the community building, the social elements of working together on a shared aims. But the more broadly, as I was trying to say, that when we see with some of the conservation activities, the benefits ripple out into the community, that people start to see that this place is cared for. And we see this with other things like litter picks. And I think it's called the broken window syndrome as well, that as people start to feel more pride in their space, a sense of place and a sense of space, it starts to ripple out and people take more care. So I think, like I was trying to say, we get these nested layers of benefits and nested layers of consequences, which can be difficult to pick up in evaluations when we're often looking at those direct benefits. We're trying to use a scale, how much better do you feel, and so on. But I think it's really important to think about those group-based sort of ripple effects that we see with some of these activities.
Brilliant. Thank you so much, Becca. And I'm sure there will be more questions, but we'll keep them in the Q&A for now. But thank you so much. That was a totally thorough go through of all the different levels, and it's really great to see the evidence building and your work kind of continuing to grow and to reach more audiences. So thank you very much for all that you're doing. Thank you. Great. Okay, now I'd like to introduce Carrie Newson, who is the Great Green Space for Health Programme Director at CSH. And Carrie will present the NHS Forest highlights of 2021. Carrie.
Great, thanks very much indeed, Rachel. Now I just share my screen. Great, can you see that okay? Is that right? Can you see it?
Yep.
Lovely. Well, it's been really great to hear from both Judy and Becca and to have both inspiration and evidence, which I think is a magical combination and a very effective one in policy terms as well. At CSH, we think that hospitals and health sites, all kinds of health sites, have a really important role to play in helping to address green space inequalities, both by improving the biodiversity of their sites, but also by developing their health and well-being potential as green spaces. And I think our programme really beautifully illustrates some of the ways that that can happen. We've been really fortunate this year to have funding from the government's Green Recovery Challenge Fund, and that's enabled us to expand our work and to take new directions and really run with the NHS Forest and the wider Green Space for Health programme. So I want to give you the highlights from what for us has been a really pivotal year. First of all, working with health sites across the UK, we're growing the NHS Forest. So the forest now has well over 77,000 trees. And this year we've had many more trees to give away to health sites, funded through Green Recovery, but also through our other very much valued funders, including members of the public who choose to sponsor trees on our website. In the last tree planting season, we planted nearly 4,500 trees. And in the coming tree planting season, NHS sites have placed orders with us for more than 10,000 NHS Forest trees. So we're really pleased about that. And we still have trees to give away to health sites. So if your health site wants some, then do please get in touch with us. The NHS pledge to reduce direct carbon emissions to net zero by 2040 has helped to fuel that interest in tree planting. And that's partly about locking away carbon. In very broad estimates, a mature broadleaf tree can store a ton of carbon in its lifetime. But it's also about the multiple other benefits that trees can bring. And I think that's reflected in the wonderful variety of projects that we're seeing at grassroots level, where our trees are actually going into the ground. So in Nottinghamshire, for example, where we're working with the Trust for Conservation Volunteers, we're contributing 1,000 trees towards a large flood prevention scheme at Rampton Hospital. At Basingstoke and North Hampshire Hospital, we've got 366 trees going there, and they're going to contribute in part to the creation of a beautiful area with fruit trees and wildflowers that's going to be a really lovely, peaceful space for both patients and staff, as well as providing hedgerow planting that's going to improve the wildlife corridors of that site. And then in Oxford this year, we're going to be working this coming season with partners at Earthwatch to plant a tiny forest. That's an especially dense, fast-growing area of woodland, a way of intensifying carbon absorption in a small space. So it's our first tiny NHS forest. We're also really delighted to be supporting Great Ormond Street Hospital in London, their staff on a cycle relay to Glasgow for COP26, the Climate Change Summit, with the offer of NHS Forest trees to be provided to children's hospitals that want them along the route. So we're growing the NHS Forest at pace and in many different sites, but we're also growing a good practice network that thrives around it. That's an alliance of more than 200 NHS Forest sites that are working to improve the quality and the use of their green space for patients, for communities, and for local residents. So the NHS Forest, like all forests, is about more than trees alone. We have hospitals in our network that are working on all kinds of green spaces, from meadows and therapeutic gardens to green cafes, interior green courtyards, productive allotment spaces that can supply the hospital kitchen, and outdoor art installations. And to help in growing that network and making sure that health sites have an opportunity to share their ideas and experience, this year we're going to be redesigning our website to reflect that. And we have plans for a launch of that early in 2022. And we've been gathering a lot of material for that purpose. So we've really enjoyed being able to go out and visit a good number of NHS Forest sites around the country and having the chance to see the fantastic green space work that's going on at sites like these, some of which you're going to be hearing about a bit later today. So this has evidently been a hugely challenging time for NHS staff. And we've seen that reflected too in the green space work of our health sites. For a long period, they were unable to bring volunteers onto site, and the gardening teams that are really so important for green space projects at hospitals have been very depleted and have only recently started work again at some sites. We've also heard from some health sites who've chosen to mark the terrible loss of NHS staff through the pandemic with green memorials such as commemorative woodlands or commemorative gardens like this really peaceful reflective space at Broomfield Hospital in Chelmsford. At this time, especially, we've been really glad to be able to further develop our work on workplace wellbeing with a programme of outdoor wellbeing sessions for staff. And you're going to be hearing more about that as well a bit later today. I also wanted to mention our Green Health Routes programme, which is supported by the Postcode Lottery and which has continued to expand into new areas of Oxford this year. It's a green prescribing project which produces co-created neighbourhood maps like this one that raise awareness about local green space on the doorstep. And it supports people in taking walks in green space from local health centres. This is our East Oxford walking group, which had to suspend walking during lockdown, but then thankfully resumed again last autumn and is still going strong a year later. This year, in partnership with Plant Life and with support from the Welsh Government, we were really pleased to launch our first Meadows Health route. It's a signed route that runs from Ysbyty Gwynedd Hospital in Bangor to nearby Eithinog Meadow. And we're continuing to work with the hospital to promote that route to staff and to patients. But the newest part of our programme is our Nature Recovery Ranger project. These are rangers who are employed by us, but embedded at health sites in Bristol, in Liverpool and West London. And they have the remit of connecting patients, staff and nearby community members to nature. They've done amazing work, running all kinds of sessions, allotment gardening, nature talks and walks, bio blitzes, litter picks, bug home creation, perennial wildflower planting events, woodland conservation days, all kinds. And they've also, as well as really helping people in terms of engaging with nature, they've been fantastic advocates for nature at these sites, encouraging biodiversity and biodiversity awareness. And all three of them at their sites have really embraced meadow creation through No Mow May earlier this year. And the results have been really rewarding. At Broad Green Hospital in Liverpool, for instance, we had the discovery of a couple of dozen orchids in the grounds in an area that they hadn't been seen before. So that was a real highlight. Each of the rangers is involved in great projects at their individual sites. At Southmead Hospital in Bristol, Phoebe Webster is working with volunteers, including a former patient, and working in close consultation with nursing staff to develop a garden for the Rosa Burden Centre, a therapeutic space there for neuropsychologic patients. And then in Liverpool, our ranger Fiona McGarrell is reviving a courtyard wildlife garden, working with excluded children and staff. And the children are not only making items such as bird boxes, but designing the garden themselves. And then at Mount Vernon Cancer Centre, well over 100 staff joined a site-wide gardening contest, Primp Your Patch, led by our ranger Karen McKelvey. And they've had a real summer of green space activity there all over the site with people cultivating patches of ground close to where they work. And that culminated in a fantastic celebration with Kim Wilde, the singer and TV garden designer, presenting the awards on the Mount Vernon lawns. It's fantastic to see those lawns being used in a way that's so sociable and something which hasn't happened for a while at Mount Vernon, but is something that is now happening again post-COVID. At Mount Vernon, we're also really looking forward to the opening of the Fern Garden in November, which is going to make it possible for patients to have chemotherapy treatment outdoors in a specially made wooden shelter. So we're really looking forward to seeing the next stage of that work unfold and also, of course, to seeing what we can learn from that. So we're really very excited about the work of our rangers, and in a moment you're going to get a chance to meet them. But before that, we wanted to take you out to their sites with this video.
I think a nature recovery ranger, so it's a very new role in the world, is about recovering people with nature and recovering nature for people. So I'm trying to increase the biodiversity of this grounds, and I'm trying to get people connected with nature for their health and well-being.
We would not have been able to do so much of what we've done since April if we didn't have a Nature Recovery Ranger. We've put on so many events, so many interesting events, berry picking, allotment sessions. The quality and the quantity of events that we've been able to put on is so wide, and the amount of people that we've been able to engage with is so different to what we usually are able to do. The benefit's so clear.
Everything that I do, I try and involve staff, patients and members of the community. So it's really my job to hone in on what they're interested in, and also how I can talk to them in a way that they're going to understand what is so important. So the kinds of things that we do really hugely varies. We go out into this woodland and we're taking out invasive species, but then also I can go into a patient's room and sit with them and talk about images of plants that maybe they can't get outside to see.
It's taken me out of my clinical role, still benefiting the patients. So obviously our day-to-day is very much on the ward, treating patients. It's very medical, very clinical, and you come and you step away and actually this will benefit our patients just as much, because you're giving them the opportunity to come outside, get the fresh air, be in nature, and that's going to be part of their rehab journey.
The main thing my role does is give people permission to use these green spaces for something they want to see happen, and that's magical to me, because to see people go, oh, we can do something in this bit of ground is great, and they then start using their imagination to think about what they'd like to see and do. So it's been brilliant, that.
The difference that it has made has just been immense. I think the outdoor space project has just flown and expanded in a way that would have been unimaginable. I think the amount that's been achieved in such a short space of time has just been incredible. I've had more people suggest to me, oh, shall we make this an outdoor meeting, than has ever happened before. And I've had senior managers say to me, this needs to be on the agenda, and I think all of these things didn't happen before.
It's been a really good way to just start that conversation about how green spaces are so beneficial for your mental health, for your well-being, for your physical health, and obviously we're a hospital, so anything to do with your physical health, your mental health is really important.
I think when you're at work, you don't think of it as a place of relaxation. You go there and you go home. Someone also said to me it's really nice to come to the allotment before going home, because it breaks up your work from your home.
There has been a great deal of engagement on site. You know, it's not just about what has been done practically to the site and on the ground, literally on the ground. It's been the involvement of people and the response of people to what the activities that has happened. It's been the relationships and making sure that people have really been brought in and are really aware of the outdoor space, and they are embracing the opportunities to get involved.
What I'm seeing is people are being pulled out of the building more by the kind of work that the Nature Recovery Ranger is doing. It's a fantastic programme. It's enabling things we couldn't possibly have done with our own staffing and in the time that we have available.
I can't imagine not having Fiona here anymore as our Nature Recovery Ranger. Before she joined the Trust, we were working on green space, but it was really slow, and then since she's joined, the amount that's changed is unbelievable. We have so much green space and so much land, and it provides a real opportunity to improve that and make it more accessible to our staff and local communities.
I really think every hospital should have a ranger. There's so much green space on every hospital. One of my other hospitals, people kept saying to me, oh, there's no point you going there, there's no green space. I went there, there's loads of green space, but it's just not being utilised in the right way. I feel like a ranger at every site would be there to make sure that happens.
Hi everybody, welcome back, and I hope you enjoyed that video. Apologies for the slight hiccup. So we're going to have a panel discussion now with the Rangers and with the Green Space. Hi everybody, welcome back. About the benefits and challenges to their work on sites. So I'll let everybody introduce themselves. I'm going to start with Karen.
Hi, I'm Karen. I work in Mount Vernon Cancer Centre in West London.
Thanks very much, Karen. Phoebe.
Hi, I'm Phoebe. I'm based at Southmead Hospital in Bristol.
Welcome, Phoebe. Hi, Fiona.
Hi, I'm Fiona. I'm at the Liverpool hospitals.
Great. Thanks very much. Ginny. Hi.
Hi there. I'm Ginny and I'm at Mount Vernon Cancer Centre.
Nice to see you. Esther.
Hi, I'm the Sustainable Development Manager for North Bristol NHS Trust.
Great, thank you very much. And Lucy?
Hi, I'm Lucy and I'm the Sustainability Officer at Liverpool University Hospitals.
Brilliant. So thank you very much for your inspiring work, all of you. And there's a few questions for you. So one of them is, somebody says they're working on a project and the no-mow regime has been difficult for people to take on because it can be seen as messy. So the question would be, how do we bring maintenance custodians on board with the messiness of no-mow May, I suppose? Would anybody like to answer that one?
I think we can probably answer that one. So we did No Mo May at Southmead Hospital this year, actually. And I think it was a really good initiative, and we did get feedback that it looked messy. One of the things the grounds team wanted to do was still mow the edges, really narrow, just so the pavements are clean and tidy. That was something that they really wanted to do. I think also talking to the grounds team, doing a site walk with them, understanding their concerns, and kind of educating in a way. Our grounds team already know a lot about meadow management, are really knowledgeable, but your grounds team might not be. So I think that was a really good way. And actually, it was so popular in one part of the site, we've written it into the contract for years to come. So it's going to be an annual thing, which was really great. But I think engaging staff, so we did the pollinator counts as well. So we got staff to come out and count flowers with us as a team. So that was really good and educating, and taking lots of photos. And we put posters up, kind of oversight stuck on canes, which I think then told people why it was long, and it was being looked after. It was for a reason, and it was going to be mowed in the future. Yeah.
Thank you very much. So brilliant. So do either of the other sites want to just chip in there?
I would like to say I have a contractor who it took a good long while to persuade that a meadow was a good idea, because he's built his reputation on the lines, he kept saying. But Karen, I've built the reputation on the lines, and you can see it from his website, it's true. But a great success for me is I've persuaded him to change a large area into meadow, but he does also work at Champneys, which is a very posh spa site in Hampshire. And he was there recently and being asked to maybe take away this longer grass down to lawn again. And he's managed to convince the site manager there that 5 hectares of his land at Champneys should go to wildflower meadow and nature. And I've been working with Karen in Mount Vernon, he was saying to the guy. And so that's an amazing extra thing that's happened as a result.
Fantastic. Excellent, thank you so much. So involve people, keep going, involve them right from the beginning, and so on. Yeah. So can you, there's a question here from Sarah Lawful. How many of these exciting projects are involving children and young people?
I'll take that one.
Yeah, no, great.
So I think the easiest kind of groups to get involved have been community groups, and as we're all funded, we're offering free services to schools and community groups. So at the moment at Aintree Hospital, I'm working with a group of excluded youths who are coming in, and they're completely redoing one of our courtyards, planting them all up. It's been fairly easy because we're not asking for any money in return, and they feel like they are giving something back as well. I think going out into the community and speaking to local schools and local nurseries is particularly good. I've been
trying to figure out which ones are the ones where our staff actually have children in as well, so that we can do programs involving both of them.
Fantastic, excellent. Any of you on site want to?
Yeah, so we've had a few kind of guide and scout groups, specifically rainbows and cubs, coming to the site, and actually their leaders work at the hospital, at Southmead Hospital, and so they've come forward to me, which has made my job kind of easier. And we ran a few sessions with the rainbows, and we made sure it ticked off their badges as well, so they really got something out of it. So we did gardening at the allotment, and we did a mini beast hunt and insect hotel building with the rainbows, and then recently last week with the cubs we did a insect hunt and a mini beast hotel building in a different area of the site down in our kind of wooded area, which is really, really great. And yeah, and a few of their parents actually work at the hospital, and it was a really good way of engaging, and everyone saw them coming to site, and they all wore high vis, and it was really, really great. So that's another good route, as well as schools. I think scout groups, they're always really, really keen to give back to their community and get their badges, so I think that's another good way.
Brilliant, thank you very much. Any other questions? So there's one here, which is from Joe Hobbs. So Joe says, we also really need to consider that trees need management and support to grow. I've not been able to promote tree uptake because people have to commit to maintaining tree health, and this can be demanding, especially given obviously, you know, crises in the NHS, and also the fact that, you know, people move around. There's a lot of movement in the NHS with people. So I wondered if Lucy, Esther or Ginny, one of you would like to comment on that.
I think for us, we've been quite beneficial that we've got our director has really bought into the scheme, so it's been approved top down, and we've been able to embed it into the maintenance schedules as well. So that means that for years to come, they will be maintained properly.
Okay, brilliant, thank you. So you've gone straight to the top. Ginny.
Well, I think Karen's played an essential role here, as far as we're not the landowners, so we have to work with another trust, and you know, making sure that a communication line is open again, as we've said before, and talking to people and I think actually Karen being on site, because we obviously talked about this sort of project before she came. I think Karen being on site has made a great deal of difference to that relationship building exercise, and making sure they're on board and keeping them up to date, and as she's already said, educating them as well, I think.
Okay, yeah, sure, thank you very much. Esther, anything to add?
Just to say that we've had a lot of support from our grounds team at Southmead Hospital, but we've got sort of two different approaches. We've got the longer term, what happens when we sort of adopt the trees, but in a lot of cases they are, the newly planted ones are looked after by volunteers. So it could be volunteers that come through the local authority or through the Forest of Avon, and they keep an eye on things whilst they're in their sort of early years. And then it passes to us to maintain them in the longer term.
Great, thank you very much. So there's some questions here about finance. So how are the rangers financed? And as Carrie said at the beginning of her introduction, we were lucky to get a grant, a government grant last Christmas time, which has basically funded this work. We are looking for ongoing funding. There are obviously various ways to do this via grants and things like that, or potentially working with the trust themselves. But we would love to spread the nature rangers to other sites, and obviously help other people to get them. So definitely, if there are people who are interested in having a ranger, contact us, and we will do our very best to include you in our plans and to try and find funding, not only for the ones that we have already, but for more in different sites. So obviously funding, as we all know, is a huge issue, and important to sort as much funding as we can before we we try and grow the programme. But hopefully there will be a huge, I know that there's a huge amount of work done already, huge amount of work done during this whole year, lots of evidence built up, lots of good quotes and examples, as well as videos and so on. And so hopefully those 3 case studies will provide good evidence to support the idea of nature rangers in other sites. So we're hoping to get that out to as many people as possible so that we can get some more funding in. Any other thoughts from any of you before we finish this session?
In terms of grants, at the moment, I've just applied. We don't know if we have it yet. We're working to do an orchard, so I think that's another thing. Is like a really small grant proposal that I've just done myself. That's always something to do. If you don't have a ranger, you can still, if you have the time, find council funds. I think it's Forest of Avon Trees have a small fund at the moment. So working through those has been really good. We've had a few donations. I think if you ask, you might get. I think it's always worth trying your luck with nurseries. We've had a few donations from nurseries as well. You tell them about the project. They're always really interested to find out. And that was really
great.
wonderful.
Thank you very much. Thanks, Phoebe. And so yes, ask. If you don't ask, you don't get. Do ask, and also local connections. I mean, you know, sometimes people leave things in their wills. There are local businesses who might be interested in sponsoring things. So definitely make connections and ask around. Great, thank you so much, everybody. So we are going to have a 10-minute break now. And welcome back to everybody. I hope you enjoyed some networking in the break, as well as a cup of tea. So it's my pleasure now to introduce Athena Rice and Michael Connors. Athena is CSH's Green Space for Health Partnerships Project Manager. She oversees the Rangers Project and the Workplace Wellbeing Programme. And Michal is Director of the Natural Academy, which is an eco-social enterprise which has been delivering our staff wellbeing sessions in healthcare settings since June. So Athena and Michal, over to you. I think Michal, you're going to start, are you?
I'm going to start actually, Rachel. Thank you so much for the introduction. And I'm going to start by introducing CSH's background in wellbeing and nature projects. So we've been interested in wellbeing and nature for a very long time. And as part of this interest in 2019, we ran Space to Breathe, which was a major project to investigate the desirability of enhanced nature connectedness, specifically in relation to staff stress and what staff at NHS sites felt that they needed. And this interest, as well as the findings from Space to Breathe, which is available on the CSH website if you'd like to read the report, this interest lies behind our inclusion of a wellbeing and nature element of the larger Green Recovery project that includes the Rangers and some of our other activities. Space to Breathe showed that staff very, very much valued the time they could spend in green spaces as a way of de-stressing. And over 80% of them said they would like to spend more time in green spaces around their workplace in particular. And they felt that that time with nature was healing and stress releasing. So we wanted to see if we could build on these findings by providing some targeted stress busting skill development. And that's what led us to include this wellbeing in nature element of the project. And in order to deliver that, we commissioned a program of wellbeing in nature sessions at our 3 Nature Recovery Ranger sites, Aintree in Liverpool, Mount Vernon, Northwest London, and Southmead in Bristol, and 2 other sites in East Kent and in Sussex. And these sessions we felt would give us an opportunity both to provide much needed natural healing sessions to some NHS staff, and also the opportunity to conduct some evaluation of the impact and effects of natural healing activities. And as part of that, we also included some training for staff in order to be able to deliver their own sessions. And I think Michael will tell you more about the sessions and the training. We chose to commission the Natural Academy and Michael and his team to provide those sessions and the training because of their extensive previous work in this area and their very strong evidence-based approach to developing the Nature Well program. So we're very grateful to Michael and his team. And Michael, please do tell us more about the project.
Thank you, Athena. And thank you for that introduction, and thank you to the Centre for Sustainable Healthcare for inviting us. I'm just going to share some slides, which hopefully you will all see. So what we have developed over many years is what we call the Nature Well approach, and we've adapted that in this project and in exploring the power of nature for workplace well-being and equitable recovery. And I just want to do a very brief overview of that. Firstly, looking at the roots of this. So the roots really come into burnout prevention and recovery. And the work of Anne Sturks, who's here actually at this conference, and the work that she's done and the work we did together. And that's really a route that's really helped us understand how we can work perhaps to prevent people reaching stress levels that could lead to even burnout. And Nature Well is an integrative approach helping people in nature. And this project is that, and that's fantastic. And that's what we feel really supportive of. And really appreciate how we can support staff well-being, but also create access and generate support for hospital green spaces. And it's been wonderful working in those green spaces, and especially spaces which have nature rangers. And the rangers make such a difference, as you could see in that video. And it's been wonderful having an opportunity to work with them, and all our team have really appreciated that. However, we've also worked at centres without rangers, and that's also been wonderful. So that integrative approach has certain components. One is, as we talked about and we heard earlier, about nested benefits. We really bring in the idea of the personal, social and ecological into a holistic health model. And that's really woven into the Nature Well approach. Also within that is nature connectedness and the 5 pathways to nature connectedness, which some of you have probably heard of. It's related to work of Derby University and other universities, Miles Richardson. And we bring in this as a framework to help us contain the sessions, and we'll talk about the sessions in a minute. We also have appropriate developed nature-based activities, which we've developed over many years, which are offered as health and wellbeing interventions. And the session is structured to encourage personal resourcing within a positive psychological approach. So we're not going into the therapeutic process as such. We're looking more at how people can find resources that can build their resilience. And if you're interested in further reading, there's a reference there to Miles Richardson work in Beyond Knowing Nature, Ryan Lumber and David Sheffield as well. So the Nature Well program, what did we pull together? So in discussions with Centre for Sustainable Healthcare, before we set off, we looked at the idea of a 3-hour weekly session, and that felt like quite a significant thing for us to bring into, in nature and into the NHS. But we decided to go ahead with 3-hour weekly sessions, and then a post 1-hour individual session focusing on work-related resilience planning. It felt like we really wanted to embed nature connection and nature connectedness into the staff experience, and therefore to encourage ongoing well-being. And we also developed a participant handbook for reflections, notes, and further information and evidence that could be contained in that handbook. The key was resourcing the participants. And we looked at 3 main areas: individual strategies, toolkits, and related learning and knowledge. And this is coming out of another reference, Eva Saulin's work, Nature-Based Stress Management course, which she looked at in Sweden. And we really felt that this was a really nice way of looking at resourcing and resourcing people. So individual strategies and practices for self-care, how people can take those away with them and embed them into their life and into their workspace. Toolkit of just simple techniques and practices, very, very simple, with the idea of what we call the 3 R's: restoration, or relaxation, restoration, and revitalization. And then also related learning and knowledge, so that there's an understanding of how nature connectedness can really help us and develop our own well-being and health. So we really focused in on that, resourcing the participants. So how did we do that? Well, we have for many years been designing Nature Well sessions, and they have a standard structure to them, a certain process that we bring people through. An example, so if we start with contact and beauty, we might start with always with a grounding, an arrival, a bit of mindfulness in nature. We might then come into something like contact and beauty, which are 2 of the pathways. And obviously when we're doing 3 sessions, we're doing 2 pathways per week. And the contact and beauty, we would help people come into connection to nature. And then we did something like a beauty loom, an activity and intervention. And you can see some pictures there of some of the wonderful beauty looms that were produced. And that would be reviewed. We would reflect on that. We would spend time looking at how that process of connecting to nature, contact, and coming into connection to beauty could really resource people, and thinking of those 3 R's of relaxation, restoration, revitalization. And really, people would find so many different ways that they could access those resources. And then there would be a take home. Notice 3 things of beauty at home, which is also from Miles Richardson and the work that they've been doing, which is a really nice way of just very simple connectedness. So we delivered this, and this is some of the team of our delivery team on facilitators. And there were 9 different Natural Academy facilitators. We delivered 10 programs across 5 sites, supporting 52 members of staff, which is significant. And really feels like it was a great project, and we really enjoyed working in it. One thing that we have always thought about was embedding this in the NHS and really looking at how we can support this in an ongoing way and sustain it. So staff at all 5 sites, there's been 2 members of staff from each site, and they are now in the process, and we've got 10 members of staff going through the our level 2 Nature and Health Facilitator course in Nature Well. That's 6 days of training delivered in 2-day blocks over 3 months. 2 blocks have been online, and 1 block is in person in central London. Now, the question for me is ongoing support to embed the service, and I think that's really important next steps. How do we help staff within the trust continue to deliver these services to either to their own staff or start to bring it into patient work? And we're really keen to explore that over the coming years and months with the Centre for Sustainable Healthcare and other funders. So if you're interested or any questions, you can put them in the chat. I can maybe pick them up, but if you want to, you can contact us directly on info@naturalacademy.org. Now, obviously, we're really interested to see, has this worked, or has it, what have been the benefits of this? So Athena has been doing a great job in developing an evaluation that's sitting alongside this. So I'm going to hand back over to Athena, who's going to begin talking through the slides that she's got together for the evaluation. So over to you, Athena.
Thank you so much. It's been really exciting to be evaluating this, and I've had lots of informal reports from participants saying how transformative they have found these sessions. And so I've really just gathered together some indicative parts of the evaluation that we've had so far. We are partway through a complex evaluation in which we asked people various questions about their well-being before and just after the sessions, and then we'll be asking those questions again a month down the line. So we're still only partway through that evaluation. But what I can report is that it's been a brilliant success, and that it has demonstrated the value of that integrated approach that we've heard so much about already today. So one of our questions that we asked our participants was just what words came to their mind to characterize the Nature Well sessions that they experienced. And these are some of the words that came out, and the bigger words were words that were mentioned more often. And all of those words are exciting to see and really satisfying. But the one that I have to admit I was most excited by was the word breath, because as I mentioned earlier, we started with space to breathe, and it was brilliant to see that that's actually what many of the participants got out of these events. And I just brought along a few quotes to give you some sense of the interconnectedness of this program with all of the other things that we're running. And here's one of the participant comments. These were open comments from the participants. And one person said, taking time out to breathe and focus on the trees, even for 2 minutes, has really helped to ease my stress and anxiety. And that was so much our aim and our objective, was to relieve stress and anxiety and to give people the skills that they would be able to continue. And as Mikhail said, that 1 hour one-to-one session is so important in making sure that people go away with individual actions that will help them. And again, just a joy to see the word breathe in there. Another participant said, consciously choosing to notice the office's natural surroundings, feeling more positive about how to facilitate patients' engagement with nature. So not only is this having an effect on the staff themselves, it's also going to have a knock-on effect on patients, because staff have now got ideas about how they can help patients engage with nature to feel better and recover faster. Next one, Mikhail, please. Thank you. And this one's short but sweet. Plants are now part of my office environment. So here's someone who's actively transforming their own environment as part of this understanding of how nature can help them feel less stressed at their NHS jobs. And I have one final one to end with, Mikhail, which I think brings us back full circle to the Rangers, which, as Rachel said, is also one of the projects that I'm involved in. And this was a participant who said, I make sure when I am at work, I walk around for 10 minutes around the grounds at work. We have a new nature area being built and look forward to sitting in this area when completed. And that's precisely an outcome, as Mikhail said, about the integrated approach we've taken. So this participant has learned some skills, and the Nature Recovery Ranger at that site is helping to develop green spaces for them to go on and continue to use them. So we're absolutely thrilled with the outcomes of this and look forward to doing some more analysis of our evaluation and come to some further conclusions. Thank you.
I'd like to just thank all the team who have been involved in this. They've done a great job. So thank you, everyone. I know a lot of them are here. So we can hand over now to Suzanne.
Thank you very much, Michal and Athena. Very, very lovely to see what you've been up to, because I haven't seen much of that myself yet. Fantastic. So I have the pleasure of introducing Suzanne Tarrant. Suzanne seeks to integrate the deep healing power of the natural living world into her practice of psychotherapy, her role as head of staff psychological wellbeing for Hywel Dda University Health Board, and into her own daily life. She sees our relationship with nature, with ourselves and others, as a central focus through which we can overcome trauma and challenges and learn to live with fluidity and balance. More recently, Suzanne's been leading the green health agenda in her NHS organisation, supporting green space improvements and engaging leaders and staff in nature connection and the benefits of biophilic design. So Suzanne, thank you.
Thank you very much. I'm going to hopefully share my slides. That's not working for some reason. Let me come out again. Apologies.
Okay, can you can press the share screen and then find the right image on yours, and then remember to press the share button on that screen.
Okay, I'll try again. There we go. So is that showing?
That's perfect.
Okay. Thank you very much. So croeso and welcome everybody. Thank you very much for inviting me here today. I'm delighted to be able to share some reflections with you, as well as a brief guided visualization for bringing nature to mind. Okay, I'm just struggling to, wait, there we go. So I invited you to spend some time in nature before today and to find something that represents how nature calms you and grounds you, eases your mind. And if you found an object, you're welcome to have it to hand now. But if not, this is absolutely fine. I'll be inviting you to join me in a brief nature connection exercise in a few minutes' time. So we are remembering the essence of our being, that we are nature. We are on this collective journey of reconnection. We have become distant, disconnected, and numbed. And in so many ways, as a species, we have entered into an exploitative and abusive relationship with nature. But many of us now are seeking to heal our relationship with nature, understanding that what we do to nature, we do to ourselves. In so many ways, the pandemic has brought our relationship with nature into very sharp focus. along with the intensifying climate and ecological crisis. Our NHS staff are experiencing exhaustion, burnout, the impact of loss, trauma, and moral injury. We need to respond to this in an intelligent and compassionate way, and this requires a multifaceted and systemic approach, including addressing funding, recruitment, staffing levels, workflow, autonomy, and so on. But considering our relationship with nature within this context is also vital. Nature offers huge potential in contributing to the programs for rest and recovery that our NHS organisations are developing for our staff. There are many ways to weave a renewed relationship with nature into the world of NHS work, improving biodiversity and the green spaces in and around healthcare facilities, working with communities and in the wider landscape, because nature knows no boundaries. Also engaging our staff in nature-based activities, both at work and in our personal lives, and through biophilic design, creating healthcare environments that are truly health-giving. This may all sound quite simple and doable, but we do face significant challenges. Staffing levels are often critically low and work demands are ever increasing. It's difficult for staff to take any time out. It's certainly easier for some to do this than others, depending on our roles. In many ways, we are witnessing a significant nature time poverty and lack of equity across the NHS. Oftentimes, the staff most in need of the breaks are those least able to take them. So much work is underway to address the cultural issues around our ability to take breaks, focusing on, for example, permission from self and colleagues and our leaders, providing effective role modelling, raising awareness of the benefits and evidence base for good rest, and creating opportunities in time for taking breaks through the design of workflow and adequate staffing levels. And also, importantly, having the spaces in which to take a break, both indoors and out. So while we address these issues systemically, we can also recognise the benefits of bringing nature to mind. We can support our own well-being through using memory and visualisation, even if it's just for brief periods of time. We can develop some techniques that are quick and easy to use and very portable, that can be used no matter where you are. And it's possible to integrate these into busy shift or working days, even when you can't sit down or get outside. These techniques start in a very simple way, and with repetition become more and more effective. And we can create some shortcuts as well to help us achieve the positive emotional outcomes in shorter spaces of time. To begin, we can recognise the times when we are starting to feel very stressed and tense. We can set an intention to notice this in our bodies and in our inner world. The thoughts, feelings, body sensations and behaviours. And we can set an intention that when we notice this in ourselves, we will take a small, simple action to nurture our well-being. Like tending a beloved plant or a lovely garden, it takes time, starting with some small steps and repeating regularly. With time, the plant will grow and flourish, and you can add in more complexity as you wish. And in repeating this activity, we can intentionally build in associations to provide this shortcut to increased calmness. So let's do this now. Firstly, choose a place in nature that you have been in, perhaps one of your favourite places. It can be a real place or somewhere that you imagine. It's important to choose a place that for you sparks a strong, beneficial emotional state. Perhaps one of calmness, relaxation, peace, tranquility, or even awe. And have your found object to hand now. Or if you don't have one, you can choose a simple physical action, such as stroking the back of your hand or lightly squeezing your hands together. Your object may have come from a special place or represented in a more symbolic way. Now let's open the doors to nature connection by taking a deeper and slower breath together. And another one, and this time allowing the out-breath to be just a little bit longer. Noticing your body now, allowing your posture to relax a little more and feeling your feet gently supported by the ground. Bring to mind your chosen and special place in nature. Maybe it's easier to do this with your eyes closed if that feels comfortable. And start to really notice being in your place. What is it like here now? You can settle in one spot if you like, or move around with curiosity. What season is it in your place? What time of day? And what's the weather doing around you right now? Focusing in on your sense of sight, what do you notice? What do you see? What colours and shapes, textures, light and shadow? Do you notice any movement? And what elements of nature do you see close by to you? Or those a little bit further away? And what do you see in the far distance? Gently looking up, what do you see up above you? And looking down around your feet or where you are sitting, what do you notice there? What can you see right now that you feel drawn to, that you feel pleasure in or appreciation for? Now noticing the sounds that you can hear, those close to you, those further away, and maybe some in the very far distance. Are there any sounds behind you, above you, closer down to the ground? Is there a rhythm or a melody in the sounds? How loud or soft are they? Are they high or low in tone? Now noticing what you can smell. What scents and aromas are brought to you? Do any of them linger, or are they more fleeting? And now noticing any sensations of touch, any warmth or coolness, the movement of air or a breeze on your skin. How does the ground feel beneath your feet as you stand or walk, or underneath you as you sit? Do you notice any sensations from your clothing? And if you reach out to touch things in your nature place, what do they feel like under your fingertips? Start to notice even more now what you are drawn to that you find beautiful, calming, inspiring, or pleasant. What are the elements in the nature that surrounds you right now in your place that you most appreciate? Allow yourself to settle into or move towards feeling more grounded, more connected in this beautiful place. Allowing yourself to experience a growing sense of belonging and of being nurtured by the earth and the elements around you. Breathe your experience into your body, allowing your body to fill with what nature is offering you right now, and noticing where in your body you feel this. Then breathing in a little more, gently allowing your whole body to soften and release. Notice if you are feeling any sense of calmness, of being nurtured or grounded, and if your emotions and body are unfurling with some sort of positivity. Focus in on these feelings now. Let's notice them, let's savor them. You're even welcome to say gently in your mind, I am feeling calm, or perhaps I am feeling peaceful, or whatever fits for you. Now, taking a moment to hold your found object in your hand and feel its shape, its texture, and size. Or, if you don't have one, just do a simple and gentle action, such as stroking the back of your hand. And then bring your mind back into your place in nature again, noticing how it feels to be there, enjoying its rich beauty, breathing in any sense of joy or calm that you feel by being there. Gently weaving a wonderful web of connection between your found object, your chosen action, being in nature and feeling calmer, more appreciative and open. Noticing how you feel in nature and holding your object. Affirm to yourself right now that you can reconnect with this place, this experience, these feelings, whenever you want or need to. You can choose to elicit this experience and linger there for a while if you like and if you can, or you may visit more briefly, just dipping in to access a smaller bubble of calm. So your found object, whatever it is, or your physical action that you've chosen, can serve as the reminder, the anchor if you like, for accessing all that this place has to offer you. And each time you repeat this brief visualization and connect with your object or action, you are building a body-mind connective shortcut that will strengthen over time. And you will reach the point at which the state of relaxation, calm or tranquility that you've accessed today, perhaps, will be even more readily triggered when you take a deep breath, hold your object, and imagine even briefly your special place in nature. This is there for you whenever you need it. Diolch yn fawr iawn. Thank you very much for sharing this time with me. And may you be well in nature. May you bear nature in mind.
Thank you so much, Suzanne. I wonder whether we should have had that right at the beginning. I'm feeling very calm now.
Well, that's lovely to know.
Super special. Thank you so much. And now we're moving to 3 different sites and speakers to discuss the therapeutic potential of food growing in healthcare sites. All three are food growing projects, but in very different settings and reaching different sections of the community. So first up, we have Claire Blakey, Senior Occupational Therapist at Highbury Hospital on the Highbury Community Garden. Claire, you've got about 8 minutes, I think. Welcome.
Oh, thank you, Rachel. Hello, everyone. I'm just going to share my screen. Bear with me.
That's great, we can see it.
Thank you. Well, hello, everyone. As Rachel said, my name's Claire Blakey. I'm an occupational therapist and I work for Nottinghamshire Healthcare NHS Foundation Trust. And I'm here today to talk to you about the Highbury Community Garden. So I'm going to begin by telling you a bit about how the garden was set up and developed, and then talk about how the garden supports mental health recovery through working in partnership with the wider community, what we call our green pathway. So how we support our service users to access the health benefits of being in green spaces and taking part in green activities, both during their hospital admission and beyond it, when they've been discharged and are back living in their local communities. So to give you some context, the garden itself is located on the site of Highbury Hospital in Nottingham, and the hospital is the base for a broad range of mental health services, including adult mental health services, intellectual and developmental disability services, and community teams. So some of these services are based at Highbury Hospital and work out in the community, whilst others support inpatient services. And the garden itself is located at the end of the main hospital car park behind this colourful fence you can see in these photos. And it's just about a 5 or 10 minute walk really from most of our inpatient wards. And here you can see our starting point. This is the area of land that it was agreed we could have to set up a community garden. And as you can see, we inherited some trees and a beautiful old wall that now supports a number of fan-trained fruit trees. And the idea of setting up a community garden came from a growing awareness about the health benefits of spending time in green spaces and the recognition that there was a lack of a community green space on the Highby Hospital site. So our starting point was to gather the views and ideas of service users, staff and volunteers, and basically get as many interested parties as possible involved in the planning and decision making. The initial feedback was that people wanted a multi-purpose green space, a place to learn how to grow your own food, a green space to take part in a range of therapeutic activities such as art, music, physical exercise, social and community events, staff well-being, and a place to relax away from the wards. So from the outset, the aim was for the garden to be a shared community space that belongs to and is shaped by the community. And so service user involvement and community decision making was and still is very much at the heart of what we do. In the early days, this meant that service users were actively involved in things like the design of the garden, the choice of the activities provided, the name of the garden, and even the designs for each side of the shed, as you can see in these photos. We've also held planting days where service users and staff from each of the wards and units have planted trees, collaborative art projects. I think on a therapeutic level, it's vital that people's ideas and contributions are valued. And for the long-term future of the garden, it's vital to build a wide base of individuals and groups who are invested in the garden. So when the garden opened in 2016, it was fairly modest in terms of its resources. We just had one shed, one greenhouse, 9 raised beds, 1 compost bin, and I think 4 benches. The gardens had to be developed in stages because we're dependent on sourcing funding each year. So what we can do is determined by what grants we can secure and what funds we can raise. Fortunately, we've had quite a lot of success on the fundraising. So we now have 20 raised beds, 2 sheds, 2 greenhouses, fruit trees, a sensory garden, a wildlife area, table tennis table, a gazebo to provide much needed shelter. And we now have a full timetable spanning a range of activities, including horticulture, art, physical activity, social, community events and staff welfare. Each ward and community group has their own raised bed, plus we have a number of shared beds, and the produce is harvested by service users and used in therapeutic kitchens within the hospital. We also have a lot of tasting sessions at the garden, and any surplus produce is either sold at events to raise funds or maybe used at staff wellbeing sessions. The way we work, though, is very much about having strong links with community services and resources beyond the hospital. Resources that our service users can then access post-discharge. So we talk about having a green pathway whereby people are supported to access the health benefits of being in green spaces and taking part in green activities during the hospital admission, but also beyond once they've been discharged. And we talk about the garden as being a stepping stone or a bridge between a person's inpatient admission and the wider community. We invite our community partners to the garden to provide taster sessions and information about their services and how people can access these services post-discharge. And for some people, this can be about maintaining engagement with a community resource that they had been accessing before their admission. For others, it may be about finding out about a resource or group that they've not heard of before and would like to access post-discharge. By having our community partners coming regularly into the garden, it gives our service users the opportunity to meet the staff, to establish a relationship. We can also support people to visit some of these projects and groups and complete any referral paperwork. And the feedback from service users is that it's far less daunting going to a community group post-discharge when you already know the staff, know where you're going and what to expect. And another way that we link with the wider community is through taking part in community events. So these could be national conservation events like the Big Butterfly Count, or it could be a local event. In our local area, there's an annual art festival. So each year we will hold a collaborative nature-inspired art project in the garden, such as this mosaic project. It culminates in the week of the art festival. We exhibit our work in a community venue before installing it in the garden.
Claire, you're
it's
just
all really
going over time, so.
Oh, I do apologise. I'm going to whiz through. I was just going to mention, we also, to complement that sort of the physical green space, we do provide things like gardening packs as well for people on discharge. I won't go on to speak about the virtual, but the aim is to support people to develop their own skills and knowledge to enable them to continue to access the health benefits of green spaces beyond the hospital garden. And that, in a nutshell, is the Highbury Community Garden. So thank you for inviting me, and thank you all for listening.
Thank you so much, Claire. That was wonderful. I love those mosaics. Really
beautiful.
Beautiful, beautiful. Now, I'd like to invite Lindsay Allen, who's the Rooftop Farm Manager at Boston Medical Center, US, and Operations Director at Higher Ground Farm. Lindsay, hi.
Thanks so much for having me. I'm just going to go ahead and share my screen. Give me one moment. All right. Well, again, hello, my name is Lindsay. Thank you so much for having me from across the waters to this conference. It's been really wonderful hearing from everyone else. I am the farm manager at Boston Medical Center, and I work for Higher Ground Farm. My intention for these next 8 minutes is just to give you a little peek into the window of what we do at Boston Medical Center at our rooftop farm and share a little bit of our story with you. And so for context, Higher Ground Farm, we work with hospitals and institutions to set up food production systems, both from the design aspect and then also management of them. And so we were brought onto this project before it started and worked with Recover Green Roof, another green roof company, to design in partnership with the hospital, design the rooftop, and then now we manage it for them. And so you're seeing here our rooftop farm to give you a little bit of placement of where we are. This is on one of the buildings that the hospital owns. And we built this on a roof that was beforehand just an empty space. It was covered in gravel. It's about 3 stories up, and it was completely unutilized. And we chose this location for a few reasons. You can see in this photo, if we look across the way that to the building that is kind of glass backed there, that is where a lot of our inpatient visits happen. So there's hundreds of patients that are coming through that building every single day. And we really wanted to place a farm that was at least visually accessible to the people who come to visit our hospital, knowing that we wouldn't be able to have everyone that we wanted out on the farm. So we wanted to have in a place where people could have that access to green space. And so we installed the farm. It took us about 6 hours with 25 volunteers. And within 5 weeks of planting that farm, we had a produce that we're actually harvesting here in this photo. We had produce to harvest and to bring to the hospital. I thought that was really an important goal of ours, was to immediately be able to have a product to give to the hospital, to patients, to see the viability and show the viability of this project. And I guess just to back up a bit there, we were brought in. Boston Medical Center has had a really long belief that food is medicine and wanted to be able to go a little bit more deeper into that and actually be able to provide local organic food for their patients. And they've also been a leader in the Green Hospital movement and felt that having their own rooftop farm would not only be able to provide that local, fresh, organic food to their patients, but also all of those secondary environmental benefits as well for that rooftop space. And then what I'm going to focus more on for the next few minutes is looking at all of those secondary harvests, if you will, that we get from the farm on the more community and social side. And so in terms of just to let you know where does the food go. So we're growing between 5,000 to 6,000 pounds of food a year. And I don't know the conversion into for those of you in the UK and beyond, but we grow right now in COVID. We've kind of shrunk down in where the food is going. We have an on-site food pantry that about 75% of the food that we grow on the rooftop goes to that food pantry. And then the rest of it goes to our kitchen, and then from there to cafeteria or to patient plate. And then in our non-COVID world, we also do a in-hospital farmers market where patients and employees can come and buy fresh food from the farm once a week. And I think that a really important aspect of this farm is the way that it ties in with the larger kind of holistic model of care at BMC. And the preventative food pantry is a big piece of that. It's been in the hospital for 20 years now. And all patients who come into the hospital are screened for food insecurity. If they're found to be food insecure, they get a prescription to the food pantry. And so we grow, they serve hundreds of people each week. So we are not big enough to grow all the food for them. So we grow a small percentage of the food for the food pantry. And we grow a whole variety of colors and textures and tastes up on the farm, but anything that you can really grow on the ground in terms of annual food, vegetables and greens, you can grow up on the roof and things grow really well. And so we try to focus on things that are of higher price point in the grocery store so that we are able to supply the food pantry with that. And then maybe things that aren't normally found in a food pantry. So herbs, fresh heirloom tomatoes, some of those more cultural crops that are not maybe is grown as widely. We do a lot of bok choy, we do a lot of collard greens. And then I try to find crops that grow across different cultures that are recognized, because we have a really wide variety of backgrounds that come and visit our hospital. And so then that's just a taste of the food that we grow on the hospital, but on the roof. But we also, I think, as equally important is this green space also provides us as a place to have all of these other alternative harvests that I'm just going to kind of quickly walk us through. One of the things that we've had to put on pause, unfortunately, because of COVID, has been our free summer camp program. So for the first 3 years of the farm, we did free summer camps. 2 of those weeks were for patient and employee kids. And then the other, usually anywhere from 3 to 5 weeks, was for our public school systems there, where people would come out and they would spend, the youth would spend half the time on the farm, and they'd spend half the time in our hospital's teaching kitchen. So they would get to harvest and get their hands in the dirt and, actually interacting with their food, and then taking and actually getting to cook that. So having a real harvest to plate experience as part of their summer camps. And we had so much fun. I really miss having all of the kids up there. And for a lot of the youth, it was their first time really actually, discovering when you pulled that green thing out on the other side was a carrot, and getting to touch and smell basil and herbs, and I try to have a lot of edible things that when a kid is walking around the farm, they can immediately taste, touch, smell, interact with things on the farm. Some of the other ways that we have community up on our farm is creative ways of bringing patients onto the rooftop farm. So again, our teaching kitchen, a lot of the classes, which are all free to patients, they actually start by coming out on the farm, harvesting what they're going to use in their cooking class, and then taking that back to the teaching kitchen and cooking.
Lindsay, I hate to hurry you.
For the first 3 years of the the farm being open, we also partner with the refugee center and had refugees, a group every week out volunteering on the farm and helping out on the farm as well. And then we're trying to start a partnership with the inpatient psych, where they would come out every week and volunteer and get some time outside and actually help us to grow the food there. I know I'm short on time, so I'll just quickly run through these last. Employee benefits, we do yoga on the farm, we do tours, we do free gardening 101 classes, both for patients and for employees as well. We do Iron Chef competitions with the teaching kitchen. And then of course we also have bees. When we had bees on the farm, we brought those to our inpatient pediatric unit here, and they actually painted our beehives for us before the bees were in it. And so I'll just wrap there because I know I'm at time. But I think for us at BMC, we're really hoping and trying to create a model that other hospitals can replicate of how can we grow food either on a rooftop or ground space at a hospital, and then how do we bring in those other kind of wraparound care and bring in the community in different creative ways in green spaces at our hospitals. So thank you so much. I'm going to hand it over to our next.
Absolutely fantastic, Lindsay. Thank you very much. That's amazing, really inspiring. I wish my allotment looked that productive. And our third food growing site is the Lambeth GP Food Growing Co-op in South London. And this will be presented by Suzanne, who's a trainee in child and adolescent mental health, who's been part of the Lambeth Co-op for 5 years. And she's joined by Thomas Price Ogunbiyi, a stroke survivor and current patient at King's College Hospital, who's been a member of the co-op since being referred in 2019 as part of his rehabilitation. Sho and Thomas? I can see Sho. There's Thomas. Hi.
Would you like me to go first, Sho?
Yes. So I guess just in terms of for the audience, we have a few slides, but I think this might be a bit more of a conversation. So it'd be really great if you could share a little bit about your experience, Thomas, of taking part.
Okay. Well, first of all, thank you so much for inviting me and sharing with me those wonderful photos and ideas. Be sure I'm going to go back to the group I work in and share some of those wonderful ideas. Hopefully we can try to emulate your good works. So I come to you today not as a manager, but as a patient, as a service user, a beneficiary of Community Garden. So I would like to talk to you a little bit about my journey and how I came to become involved. Now, as mentioned, I suffered a stroke in 2019, which affects my mobility and my cognitive functioning. So particularly on my right-hand side. I was referred by my OT to a garden project as part of my stroke rehabilitation. I'm so glad that I was. The garden I was first referred to was part of the Lambeth GP Food Growing, co-op.
And that was in the winter, wasn't it? It was the time during COVID.
Well, I was warmly welcomed by the founder Ed and other, volunteers who helped me to grow vegetables. And we grew many vegetables and herbs along the way, including, pumpkin and
well, I can show some pictures of the stuff that you've grown, and I should say that Thomas joined us in our food stall at King's College Hospital, and he's a really keen photographer as well.
Hobby. I've got some great content, so I can practice. But yeah, tomatoes, potatoes, beans, lettuce, and on and on. I mean, we were just growing lots and lots of different things that our team leader brought for us to grow. Thyme and spring onion.
So I think you can see here some pictures from our stalls. You can see that we were selling some plants like rosemary and basil, but we also had some pumpkins and stuff as well. And I guess together we also produced a recipe book that was in the stall, and we also kind of had a mug. And this was in celebration of King's College and their new green plan. And I think we've just had a really good time. Sorry, a colleague's just popped in. So Sorry, I was just saying that I think the veg stall was a really good opportunity to meet other NHS staff as well, in terms of learning about their experiences.
And then, as Sho said, there I was going along with my stroke rehabilitation when, you know, the COVID pandemic struck. And I, like many others, were told in 2020 that, you know, we need to isolate and shield ourselves, you know, just lock ourselves away. And, you know, this meant a year of lockdowns and isolation. We were unable, sorry? Go on.
Sorry, Thomas. I was just going to say, from what I remember, I think initially you joined when we were having the outreach and the garden buddy system.
Yep, I'm coming to that because that really was my savior. You know, I was unable to attend the project, meet extended family and friends. My home physiotherapy had stopped. I couldn't even go to work. The repetition of each day was like the movie Groundhog Day, but, you know, far, far worse in terms of my mental health. Dreadful it was. But when I needed friends most and people to reach out, you know, but beforehand, the loneliness and idleness is really what got to me, really, was feeling that sense of hopelessness. And at that time, I really needed people to reach out. And very fortunately, the Lambeth GP Food Growing Project also had a scheme called a buddy scheme, whereby seeds would be sent out to us in our homes. And we would have regular phone calls from our buddy to see how the plants were growing and also how we were in terms of our own sort of well-being. So that really made a huge difference for me. And particularly as I found myself, you know, falling into a depression, spiraling into a depression with increasing levels of, you know, prescribed medications. And for the first time in my life, you know, crisis mental health intervention. It was a really tough time for me, but my friends in the group, they helped me to come through. It wasn't easy. It was in a dark place, as I think it's put, but nonetheless, we go forward. So after, you know, period of seemed forever lockdowns, we then the shielding was lifted, but by this time I was retired on ill health grounds after a 35-year in supported housing management, and my family, knowing that, you know, how much I enjoyed the gardening project, you know, advised that or suggested that I rejoin, and I contacted Ed and you know, the other volunteers, and I was welcomed back. But this time to a wonderful garden called the Jenny Lee Gardens. And maybe for those of you who know, Jenny Lee was the founder of the university, Open University, and wife of Nye Bevan, the founder of the NHS. So it's actually a great honor to be working in such prestigious gardens with such a lovely heritage. And I'm sure that, you know, Nye and his wife Lee, if they're looking, they would see that and be happy that, you know, their gardens are being put to good use, because we really do enjoy the gardens and we go there every day. Now, as a patient, I can tell you that there are, as an inpatient and as outpatient, I can tell you there are many benefits, therapeutic benefits to, you know, being involved in the gardens and seeing nature and being part of nature. Now, they include, you know, just connecting with the ground and with the soil and with nature, and knowing the seasons, and they keep you grounded. Sorry for the pun there, but yeah, they keep you grounded, and especially during difficult times when your mind is troubled. So that was really helpful. And also, you know, gentle exercise, and also you know, fresh air, sunshine, but more so I think socialization, opportunity to meet like-minded people who, you know, also share the same troubles and same thoughts and drive. So it was great for me to be able to come out of lockdown and meet with my colleagues back in the gardens and regain my social confidence, which I'm still working on. There's a ways to go in my rehabilitation, but I can tell you this, that my experience now is that I feel in a much better place. I'm happier, and I'm looking forward to continuing with the project and sharing some of, as I said, some of the fantastic ideas that I've already seen today. Thank you.
Thank you.
And God bless you.
Thank you so much.
You're welcome.
Both of you. So thank you very much. So now the moment you've all been waiting for, another moment, the announcement of the NHS Forest Awards. And to present them, here's Miriam Dobson, the CSH Outreach Officer who works closely with a network of NHS Forest sites. Hi, Miriam.
Hello.
Hey.
Yeah, excited to be here to announce the awards. So for those that haven't met me before, I'm Miriam Dobson, and I'm the Green Space for Health Outreach Officer at the Centre for Sustainable Healthcare. I also coordinate the NHS Forest Network, and I'm really excited to be presenting this year's NHS Forest Awards. We've been absolutely delighted with the calibre of award submissions this year, and we're really excited to announce 5 awards today. The breadth and creativity of projects across the country continues to be really inspiring, and it's clear that nature connection and nature recovery is playing an ever more important role in healthcare throughout the country. So without further ado, we'll announce the first award. I think I've got some slides for that. Great, so here's our first award, and this is the NHS Forest Award for engaging people with nature, and it's awarded to Wild Skills, Wild Spaces at the Powers Teaching Health Board. So this project, in partnership with Cardiff Metropolitan University and Montgomeryshire Wildlife Trust, engages adults and young people in ecotherapy. It empowers people who would not typically engage with outdoor activities or prescribed therapeutic interventions to provide free and inclusive and accessible sessions at local nature reserves. That includes bushcraft, food growing and other outdoor activities. And over 50 people are currently involved in this project. For our second award, we've got the NHS Forest Award for the creation of an innovative green space. So the winning project here is the CW+ Sky Garden, and this is at Chelsea and Westminster Hospital in London. So the Sky Garden was designed by Ginny Blum and is an innovative way to bring the outdoors inside. It supports cognitive function, well-being and the rehabilitation of ICU patients, as well as being a space for loved ones and staff to also enjoy. So it's actually adjacent to the ICU in the hospital. So it includes a physiotherapy area as well as a sociable space for consultations to take place amongst the plants. It's fully accessible for wheelchairs as well as for hospital beds. And the planting's maintained organically and the furniture's all designed with natural materials to create a really lovely place to be for people that can't access the green space that's outdoors. And our third award is the NHS Forest Award for the pioneering use of green space by healthcare professionals. And this is awarded to the Welcome to Our Woods project, which is at Cwm Taf Morgannwg University Health Board. So Welcome to Our Woods has worked with a huge range of NHS departments. It's worked with neurological services, brain injury hospitals, adults with learning disabilities, social prescribing from local GP surgeries, and the homeless charity platform. They base activities around forest bathing, mindfulness meditations, bushcraft and nature-based activities. And throughout lockdown, they continue to Skillshare on Zoom, and they have a pioneering digital version of woodland therapy for NHS staff, where self-care toolboxes are delivered to people's houses and workplaces, and a month-long Zoom program of woodland therapy was run this year in March. So congratulations. Our fourth award is the NHS Forest Award for Nature Recovery. And this is awarded to the Edible Airedale project at Airedale General Hospital. So Edible Airedale really has nature recovery at the heart of its growing project. They've got a 43-acre hospital estate, and they've chosen their orchard trees specifically to benefit the flora and fauna around the hospital grounds. They've planted sea buckthorn specifically to support their pair of breeding oyster catchers that return to the site year after year. And as well as this, they've created bee bankings, where soil is made into a bank and covered with sand, pebbles and mud for bees to burrow into and provide an ideal living habitat. And in return, the bees pollinate the orchard. And then the site's also managed to encourage wildlife, and the hedgerows are managed to protect the hedgehogs. So it's a really inspirational example of all of the different ways that nature recovery can be encouraged at this project. And then finally, we have an award that we give out every year. So this is the NHS Forest Award for the most NHS Forest trees planted last season. So for the 2020-21 season, the winner is Guild Lodge at Lancashire and South Cumbria NHS Foundation Trust. So last season, Guild Lodge planted 1,000 trees, and they created a coppice woodland of willow, and that provided a beautiful space to enjoy woodland walkways and supported the nature in their wetland area near their polytunnels, but also provided raw materials for use in therapeutic woodwork sessions and to build structures such as the fencing around the Grow Your Own project at Guild Lodge. So congratulations to all our award winners this year. And we're really excited to see how all these projects continue developing, going from strength to strength.
Thank you so much, Miriam. Wow, that was amazing, and I'm really excited to hear more about those different sites, the ones I haven't seen. So I've been to Guild Lodge and Airedale, but that's good, great. So we're coming to the end of, well, towards the end of the conference. So just a few pieces of information for you all, really. And I know that lots of people have been sharing things in the chat. We will make sure that we put, for example, the awards up on the website, of course. If you're not already a member, you're invited to join the NHS Forest Network, where we'll be sharing this and other information. You can request trees, you can sponsor trees, you can collaborate with us, sign up to our newsletter, and join our Green Space course in January. I think Vicky will share relevant links to some of these in the chat if needed. So we're obviously really interested to know about green space projects on health sites. Do get in touch if you'd like to share details with us, or if you'd like to learn more about any of these projects. And I think that's probably it. Thank you so much to our fantastic speakers throughout this afternoon's conference, and to all of you, of course, for being part of it. I've really enjoyed it, and I hope you have too. Lots more that we could learn from staying with one another, but we probably all need a break right now. I will take with me wonderful thoughts of connection and different types of information and feelings with me from all of these different presentations. So I feel very lucky and richly enhanced after all this time together. So thank you to all of you. And I think Vicky can share some links to videos now from the Lambeth GP Co-op and Higher Ground Rooftop Farm as we leave. So feel free to leave anytime you like, or to stay and watch the videos. Thank you very much, and thank you so much to the Green Space team at CSH for putting all this together, and in particular to Vicky, who did a lot of organisation. And thanks also to the team at Medal, who've done all the tech support for us. Thanks very much, everybody. Bye.